Welcome to On the Beat. I'm sitting here with our friends from Gastroenterology Associates in Columbus and Starkville, Dr. Ricky Johnston and Dr. William Gillespie. Thank you so much for being here. Well, it is March, and March means colon cancer awareness. And there is a lot we have to say about making people aware.
Right.
So first of all, how common is colon cancer, and what are some of those risk factors?
The lifetime risk is about 1 in 20, actually, so it's pretty high. So that's for cancer itself. Polyps, which is part of the reason we do this, to take those out and prevent them from becoming cancer. The risk of polyps is a good bit higher, maybe 30 to 40% of men, 35, 40% of men, 25, 30% of women will have polyps. And so when people ask us if they have polyps or have cancer, why did I get it? And that's a hard question to answer, but we do know that there's certain things that are risk factors for colon cancer and polyps. The two biggest ones are probably age as you get older and family history, and particularly with first-degree relatives, because a lot of people come in and cousins or grandparents had colon cancer, and that doesn't confer as much risk on them as if it was a first-degree relative. Beyond age and family history, you get into things like smoking and sedentary lifestyle, obesity, diabetes, diet may or may not. People always ask about what they can make changes in their diet to prevent themselves from getting polyps. Mm-hmm. There's some thinking that diets that are low in fiber might increase your risk of getting polyps and potentially cancer. Probably not as good as as big a risk as some of the other ones, though.
And so, if we look at that procedure, how does the whole procedure start if we're going to have a colonoscopy?
So basically, we see you in the office, make sure, get your symptoms, make sure we're doing it for the appropriate reason. And then you'll go home. The day before the procedure, you're on a liquid diet so you can eat. It's just not a lot of solid food. And then the night before, you start drinking the preparation of the laxative. You do half of it the night before, half of it the morning of. And then you come in, we do the procedure, and then you go home, eat whatever you want, and relax for the rest of the day.
The best part of the procedure,
yes,
right?
Yes.
And also, too, how often should somebody have a colonoscopy?
If they're at average risk and have not had polyps before, then actually it's only every 10 years. And people are sometimes relieved to hear that. They think they're going to have one of these every few years. And no, it's just every 10. Now, if you get into having polyps, it's going to be sooner than that. Maybe 3 to 5 years. And family history has an impact there too. We talked about first-degree relatives. So if you've got first-degree relatives that had colon cancer at a young age, we'll start screening you earlier, so 40 rather than 45, and then on a more regular basis, probably every 5 years instead of every 10.
Yeah. And first-degree relatives are like mom, dad, brother, sister.
Okay.
Not necessarily grandparents, cousins, and that sort of stuff.
And I think good for people to know, too, you were out for the procedure, so you do not feel anything,
yes,
correct?
The procedure is honestly the easiest part for the patient because they're totally out. They're dreaming about something, and most of the time when they wake up, they ask us when we're going to get started.
Very commonly, you go in to see them afterwards, and I get that question. There's no way we did anything. There's no way you've done
you didn't
this.
do anything. Because it happened that. And what do you think is the biggest reason people don't have their colonoscopy?
Probably the prep is the biggest.
Yeah, the prep or fear of the procedure, fear of anesthesia, that sort of thing.
But to the prep, we have some advances there that I think people would be interested in. When we first started doing this, people would have to drink a big gallon jug of stuff over a few hours, and they were miserable, and they get nauseated, and someone would throw up. And through the years, we've gotten smaller and smaller volume preparations. And then he talked about doing a split prep, which is very important. It gives us a good high-quality prep. It's easier to tolerate. And there's actually a pill out now. I say a pill. It's like 24 pills, so it's not super easy.
So you don't just take one pill.
Right, it's not one pill. It's a bunch of pills, but there's options.
Okay, wonderful. Any last thoughts that you would want people to know about screening in the month of our awareness for colon cancer?
45 is the new 50.
Okay.
That's the big one.
Okay, thank you both so much for being here, and thank you for watching On the Beat.